Armenia's president visited Korea at the beginning of the year for a medical checkup. The president's visit cost about $150,000. A renowned football coach and minister from Indonesia also visited Korea to undergo knee and hip surgeries. A Russian businessman in his 50s comes to Korea every month for a medical checkup and spends almost $100,000 each time. The Korean healthcare system has been attracting a lot of foreigners, including celebrities. It's another Korean wave, this time for the medical industry. According to a report by global management consulting firm McKinsey & Company, the scale of the global medical tourism industry surpassed $10 million in 2012. Considered a rising growth engine, Korea has been boosting the export of its medical system and promoting training programs for foreign doctors.
When we estimate economic added value of medical Hallyu, we look at value-added inducement coefficients, which calculate the input-output tables of Korea's rising medical field. According to this figure, the medical field has a 40% higher coefficient than the manufacturing sector. This means the medical field has created a lot more and has newer demands than other fields. The medical field will have a job creation effect that is about 3 times higher in the near future.
We assess the challenges facing the Korean healthcare system and talk about the possibility of it becoming advanced.
Hello and welcome to Upfront. I'm Na Hyun-kyung.
I'm Yoo Jong-soo. On today's Upfront, we assess Korea's medical sector.
And to help us with that discussion today, joining us is Dr. Hong Jun-pyo from the Asan Medical Center and Dr. Alice Hyun-kyung-dan from the Samsung Medical Center. Welcome to the program. Let's start with this question. Now, is Korea at a level where it can pride itself on having an advanced healthcare sector?
I say my answer is mixed, yes and no. So in some aspects of healthcare, such as infertility treatment, cardiac care, cancer care, I think our success rates rival those of world-class institutions around the world. However, in aspects such as hospital safety, I think we're still a developing country. There are other aspects such as mental health issues, such as suicide, where we rank #1 in the world for suicide rates. So suicide prevention, you could say we're really last.
And Dr. Hong?
Well, according to the WHO, the life expectancy is now 26 among all the countries. That's far past as UK, US, and Germany. And also in infant mortality rate, it's the 22nd. So I would say we're up there on a core medical level. But again, but you have to look in the future, and I think when I look in the future, you have to think about what's up ahead, what innovations. And when you look at the system, the infrastructure of the medical care right now, such as electronic medical records, we now provide mobile platform to look at our medical records, and also in convergence with other IT and also in transportation, I think we're way up there in front of the other countries for now.
Dr. Dan, you stated that Korea has some advanced areas, also needs to improve certain areas as well. Then, which countries are traditionally considered to have advanced medical sector?
I would say that the United States has been and continues to be a leader in academic medicine and biomedical research. Over the last 10 years, 7 of the Nobel Prizes for physiology or medicine have gone to an American scientist or researcher. Also, the NIH, which is a major health funding organization in America, their annual budget is about $30 billion, which sounds like a lot of money, and it is. It's about 1%, though, of their federal budget. But you know, where the money is, that's where the research will be. And where the research is, that's where the innovation and the new discoveries will take place. So definitely the U.S. is a leader in research, biomedical research, and academic medicine.
I totally agree with Dr. Don. I mean, U.S. has always been up there. I think there is close second players like Japan, Germany, and our country has also become a very close second. Although a lot of basic innovations and basic research, traditionally the U.S. has been far surpassing any countries, but innovations in the practical medical field, I think we're approaching a really fast first.
And I mean, we have a term, medical Hallyu now, so that's in line with what Dr. Dan just said.
Right. I think, people now from the administrative side is really searching for efficiency. The key word is efficiency now. How can we idly spend the expenditure? So I think with our infra being leaders in especially IT field, we're able to manipulate the cost issue at a very efficient rate. And I think that's why now they're benchmarking a lot, and this has thus led to an open platform for other countries to come and look at our medical sector.
Please give us some success stories.
If you look at one of the newspaper stories, the electronic medical record system and the electronic IT infra system, there was a government package deal with one of the GCC countries to export our electronic system. So I think in that kind of sense, the world is now seeing efficiency of the Korean medical sector, a very highly lucrative product, or a part where they could adapt to their country and hopefully continue the efficiency as well. Also looking at the clinical side, I think there's a lot of success stories. I think Dr. Dan mentioned a few, especially in the infertility. Not only that, you probably know that the majority of the medical travels or the medical tourism has been focused on cosmetics, dermatology, dentistry. But not only that, also in other very severe disease where medical travel is needed, especially in the transplant sector and in the heart disease, our countries has been leading the innovations in that field as well.
What's the driving force behind this? Is it the IT technology that you mentioned?
Well, if you look at the system, if you look at the efficiency, I think a lot not only has to do with the IT technology, but also with our eagerness to compete. I think Korean people itself is a very competitive people. We just can't stand to lose, period. So, I mean, the dedication of the doctors, especially at our center, the transplantation team, they work 20 hours a day. And you were just speaking about some of the achievements. At our center, the liver transplant is done about 400 cases a year, especially for the living donor liver transplants. And that's more than the whole U.S. combined. Really? So our field and our achievements in this field has really brought people to come and learn and to hopefully establish their center at their back home as well.
So I agree with Dr. Hong. There are definitely the character of the Korean people, I think, added a lot to why Korea succeeded. The success of the Korean medical industry, I think, reflects what we call the miracle on the Han River. It's just one component of that. And the work ethic, the phenomenal work ethic of our people and the doctors of our previous generations, they really laid the foundation.
Why are the Korean systems and the practice attractive to foreign countries and their professionals?
Well, they're coming to learn techniques, surgical techniques that they would not be able to learn in their home countries. So they're learning transplantation techniques, endoscopy, how to read ultrasounds, for example. And then they're bringing those technologies back home and putting them to use.
Now, people from outside of Korea could have different opinions about this. So we have an expert joining us from overseas, Dr. Mark Britnell, the chairman of Global Healthcare at KPMG, joins us. Now, sir, Korea's healthcare system meets or even exceeds the global standards. Would you say that's a fair assessment?
Over the last 5 years, I have had the honor and privilege of working in 60 countries on over 170 occasions. I have visited Korea on 5 or 6 occasions, and I have been very impressed with the high quality of medical care in Korean hospitals. I think the developments that have taken place in Korea over the last 20 or 30 years have been stunning, and life expectancy, as you know, has dramatically increased as universal health care has been applied and accessed by the population and people of Korea.
What type of contribution do you think Korea's IT capabilities will make in improving the country's healthcare system?
First of all, let me say that the average life expectancy of a Korean person now stands at 80 years of age. And as a country, Korea only spends 6.7% of its GDP on healthcare. This means that in comparison to nearly all of the OECD countries in the world, Korea has a fairly inexpensive healthcare system which produces very good quality and great life expectancy. I think many people in the West will carefully study the Korean Revolution and advances in healthcare in Korea, thanks to your universal healthcare coverage and your new arrangements for health insurance. And of course, everybody knows that Korea has tremendous strength in information technology and electronics. And I have seen at first hand, working with the Korean Hospital Association, how many of your leading hospitals, such as Samsung, are now combining the best possible healthcare with the best possible technology, with the best possible information and communications technology as well. And I believe, having traveled the world on so many occasions, that the e-health platform that you are developing in Korea, coupled with the telehealth platform that your president recently spoke about, will make you global world leaders in this particular aspect of healthcare.
And how can Korea contribute more to the global medical community?
I believe, and I talk quite often about the Korean quiet revolution in healthcare, because you have developed fantastic services. Your hospitals, in my opinion, are some of the best in the world. Your equipment is some of the best in the world. Your doctors are certainly very well trained. And of course, your information technology and your e-health capabilities are world class. I think that the recent initiatives that the government has announced to promote medical tourism, both in Asia and of course in Russia and further afield, is a very positive step forward for Korea. I also believe that you can export your information technology. Many of your hospitals have developed their own information systems, and whilst of course sometimes there is a language barrier between Korean and English-speaking countries, your grasp and command of English is generally very good in the medical community, and I believe that you have a great story to tell.
All right, thank you very much for your time. That was Dr. Mark Brintnell from KPMG. And now we turn to Dr. Lee Jung-wook. He's said to have brought a lot of Korean-styled healthcare management system to the United States, and he runs a hospital there. Doctor, thanks for your time today. Now, what made you decide to operate a hospital with that Korean system in the U.S.?
Well, this is quite a long story, but while I was studying in the United States, idea inspired me from my personal experience and academic knowledge from school class, which is the U.S. healthcare system has some problems, especially in primary healthcare sector, in terms of access and long waiting time and low satisfaction, in spite of high healthcare cost. This comes from the shortage of primary healthcare provider in supply side. This situation is expected to aggravate as the implementation of the Affordable Care Act, also known as Obamacare. On the other hand, we have a great primary healthcare system in Korea, which has already retailized, meaning customers can find the primary care clinician all over the city with an easy access at a walkable distance, short waiting time, and responsive customer service to patient need. So, all things considered, I thought our Korean healthcare system has a comparative advantage in primary healthcare rather than a large academic hospital healthcare system. So I thought it would be interesting if I combine a Korean-style primary care system with a U.S. system. So I started a clinic in January 2014 after 2 years of preparation time.
How is it different from local hospitals? Please elaborate more on the management system being used.
Okay, first of all, the concept of locating a clinic is different from the way of doing business by U.S. primary care doctor's office. Our clinic is located at a freestanding street mall of large shopping complex with a good access point. No appointment needed, just a walk-in service. Next, our staff model is really unique. We hire bilingual front desk managers to make a comfortable cultural environment at the clinic. At the same time, we're trying to capture the Asian customers, especially a Chinese population. We have 2 physicians and 2 nurse practitioners. They share the clinic hours coverage. 2/3 of the clinic hours covered by nurse practitioners. With this way, we can reduce our operating costs. We also provide a high-level customer service, which is very responsive customers needed. In near future, we plan to adopt, integrate other ancillary services such as physical therapy and preventive health service using IC technology. Basically, our differential point is not Korean-style medical practice. We're just utilizing American, U.S. medical practice, combining ancillary sort of complementary asset of a Korean-style management system.
So how has it been so far? How are patients responding?
Our electronic medical record system sends an automatic email to our customers. So once they register to our system, so we get a really great, review and positive feedback. Almost all they gave us a 5-star. The other side of a clinician and the clinic rating side, our average score is 4.7 out of 5. According to our internal demographic data, we have seen 70% of local Caucasian residents, 30% of Asian population. When you look at the element, they are satisfied with about our clinic is for Asian population. They are satisfied with comfortable environment, culturally comfortable environment, long consultation time, and comprehensive care, which they never experienced their own country. 70% of our local Caucasian residents, they are satisfied with really pretty much straightforward service, good location, good access, no waiting time. So they are satisfied, really satisfied this kind of system.
Do you have a positive outlook on the operation of Korean-style hospitals in the U.S.?
Well, this kind of a challenging question for me. I'm not capable of forecasting kind of business opportunity. But obviously, I don't think we can make a business in the United States with the scale of business. I mean, we won't be able to compete U.S. hospital with that, academic university healthcare system as a whole. Instead, we need to analyze U.S. healthcare system both horizontally and vertically. At the same time, we have to figure out what our core competency is. With that analysis, we can find the niche market. We will be able to get into a U.S. healthcare system using a specialized service such as geriatric service, like a leukemia or whatever. So in that context, a government supporting system should evaluate not only business of scale or a scale of business or name of a hospital, they have to consider real business opportunity and then feasibility and eligibility. With that system, a small to medium-sized hospital or individual clinic will be able to find some business opportunity in U.S. healthcare system.
All right, thank you, sir, for your time. That was Dr. Lee Jung-wook from the United States. So the boom of medical Hallyu, has that in any way contributed to pushing the medical industry here locally forward?
Definitely, it has. So the influx of international patients because of the increased interest in Korea has really changed, I think, the culture of how medicine is practiced, at least in our hospital. As you know, Korea is mainly a mono-ethnic society. We all speak the same language, eat the same food, but now we're having to accommodate the needs of a multicultural patient population. We have menus in Russian, we have a halal menu, Western menus as well. We have interpreters for Mongolian, Russian, Arabic, Chinese, Japanese. So it's a completely different way of approaching patient care that didn't used to be there before. Also, the opportunities for economic growth, I think, are newly founded from this healthcare industry, medical tourism. It's creating jobs. And also it's an opportunity for medical diplomacy, as Dr. Hong was saying. People are coming to Korea to learn medical techniques, but it's a way of forging bonds with countries all over the world.
Yeah, Hallyu definitely has played a major role, especially in the cosmetic sector. I mean, if you look at beautiful actresses, beautiful singers, they want the first question they ask.
Women have the same desire.
Right.
Yes.
So the first question they ask is, can I be like that? And Hallyu itself definitely pushed plastic surgery to a different level because of the high demand, not only from Koreans, native Koreans, but from Asians around. So I think the Hallyu has a very positive and a very strong influence, especially around the population around Asia, where we share the same form and texture of skin. But I think we have to further use this kind of momentum into shelling out from the medical travel, from non-essential to medical travel for the essential. So I think this is a great platform to develop and to really make the people aware on how well advanced our medical technology is in Korea.
Dr. Dan, there has been a huge increase in cooperation and more collaboration among the medical sector and the tourism industry and the service sector. What are the challenges in promoting such cooperation?
Well, I would give you the example of the Texas Medical Center and that's in Houston, Texas. It is the world's largest medical center. They see about 160,000 patients a day. That's about 7.2 million patients a year.
Wow.
It's a huge medical center with great infrastructure. And I know this from firsthand experience because I went there as the guardian for my mother, and she received her cancer treatment at MD Anderson. One of the places where we actually stayed was called the Rotary House, and it is a hotel that's owned by MD Anderson Cancer Center. It's managed by Marriott, and it's physically attached to the cancer center. It's clean, it's convenient, it's comfortable, relatively affordable. They have this patient relations department, and so a patient can actually get their blood drawn in the hospital room, and then the labs will be ready when they go for meeting their doctor. So it's a great system. They also have shuttle buses that take patients, to different motels and hotels in that district, covered walkways so patients can walk to where they need to go. So it's this infrastructure that I thought was so impressive that we don't quite yet have in our country.
I think some of the concerns were, though, that those hospitals or the Meditels, if they are to be built, then they would, the larger hospitals will have more patients, and smaller and mid-sized hospitals will lose their patients to, the domestic patients to larger hospitals. And I think that was one of the concerns about the Meditel.
I would partly agree, but I think right now the patients are very smart, especially our Korean patients are very smart. They get all the information through the internet. And now the barriers of all the hospitals are very low, especially the quality of the gap of the qualities between each hospital is getting smaller and smaller. So I wouldn't necessarily say the patients selecting this hospital for the highest quality it could provide. I think our two hospitals are basically at the same level. And we have other hospitals remotely in Korea where they actually provide better services as well. So I don't think that really is the main focus of the issue here. I think the focus is, are we able to provide patient-centered care? And I think this is a very important part. And I think we have to look at the essence of the problem, not what if. So I think we have to really try to work this from the patient's perspective.
Well, what kind of countries should Korea be looking at to cooperate further with in terms of working with them, training them, or exporting Korean healthcare system?
Right. Well, I know in terms of MOUs or memorandum of agreements or understanding, we have in place already MOUs with Russia, with Kazakhstan, Mongolia, the UAE, Saudi Arabia. But also we have so much exchange of information already with the United States, and I think that's going to be a key component. I think there was a project called the Columbus Project, which was launched in 2011, that was for supporting the branching out of Korean healthcare industry into North America. And so having that link with North America is going to be very important. But really, we have our kind of nearby neighbors, but also we have countries abroad. Denmark is another country with national health insurance, but they've come to our country to benchmark a lot of the hospitals, learn from our hospital system as well. And so I think both countries would be able to learn quite a bit if we continue our MOU agreement.
Yeah, I totally agree. I mean, now the borders between countries regarding medicine is actually fading away. So now any patient could travel to any country to provide care. We need cooperation in order to have a continuity of medical care. For example, if the patient comes to Korea, gets certain kind of treatment, goes back home, then how is the aftercare going to be?
Or the follow-up measures.
Right. So we need to collaborate with basically any countries who's willing to send their patients to travel to Korea and for medical treatment as well. I think also it's a huge opportunity, not only for us, but also for the partner countries to really work on this together. Because in the end, I think if you don't develop together, you're not going to be a sole survivor.
So let's talk about some of the challenges that the medical industry here in Korea are faced with. Doctors are not content with their medical fees, but patients are complaining or claiming that the medical fees are too high. Why the discrepancy here?
I think we have to realize that the type of or the quality of service that we're providing is way up there. It's even one of the highest qualities in terms of accessibility, in terms of medical core service. I think we're very high ranked even as an OECD country. If you look at the top innovative countries like the US, as Dr. Dan mentioned, their national spendings is about 18% in healthcare of their total GDP, while ours is only 7.4. And this is even lower than Japan, Germany, Norway, all the countries that we look up as a very ideal medical system. I think, in conclusion, I think there has to be more expenditure, period. Whether it's for the patients or whether it's to drive innovations. With this kind of minimized expenditure, you could just really see that innovation is going to be very difficult in the future. And without innovation, we're not going to have the competitiveness that we have now. So I think the government or the regulatory body has to acknowledge, and our patients have to acknowledge, our people have to acknowledge that they're willing to pay more tax for a better service. Without increasing the expenditure, you cannot seek a better service. We were able to provide this kind of service. It was because only through a semi-socialist insurance policy, a co-pay system like the Canadian system. And through the system, we were able to fund a part of our research. And now the government is really leaning toward a more broader coverage, minimizing or reducing the co-pay segment. And that's why the hospitals are very worried on where they could get the investment to increase in further innovations and to provide an adequate salary for the doctors.
Dr. Dan?
Well, I think part of that discrepancy of, am I paying too much? Am I not making enough? Comes from the fact, as Dr. Hong was saying,